up to where they can understand what's happening with them. Let me give you some real quick statistics. ADHD is not a simple disorder to treat. 75% of those with HD will go forward and have it in the future. 50% of those diagnosed with ADHD will have oppositional defiant disorder, which is a particularly complex treatment problem. And it's something that I deal with quite frequently, as do most counselors. And 35% will be diagnosed with conduct disorder or antisocial problems. 30% will have learning difficulties, learning disabilities. 25% will have depression or anxiety disorders. 10 to 25% will develop difficulties with substance abuse. That's alcohol, drugs. 40% will be retained in at least one grade, and 35% will never get out of high school. So the earlier we diagnose this condition, the better it is for the child. It gives a better time frame to affect positive changes. This gives the child and the family more time to learn, to manage, to make satisfactory and reasonable adjustments toward a productive life. And after all, that's what we want for all of these kids. Thanks. I understand you might have some questions.
George, one of the things that you mentioned in your talk was about families and their children. Why is it important for families to become involved in the treatment of children with ADHD?
Well, the child is going to have his difficulty and is going to have the developmental disorder, but the parents have to cope with it. One of the things that's most important is for the parents to get educated to what's happening internally or subjectively to their child. And it also helps the parents to understand how to strategically implement behavior modification. So parents, it's very important you're involved with your child. It's also very important that the fathers get involved. Children respond better to fathers' voices most of the time, research has shown, especially in ADHD. So family involvement is critical to being successful for that child and for long-term success.
I have a question for you, George. You say that ADHD tends to run in families. Can you explain a little bit about more about what that means?
Well, it seems to be found most often in the first-degree biological relatives in families. That's not people you marry, it's people who are in your same, have the same blood as you do. And we don't really know what causes ADHD, but there's probably a number of different genetic factors involved, and it's something that they're doing a lot of research and trying very hard to find out. But it is a disorder that is lifelong for 75% of the people who have it, and it's a disability for them in achieving the goals that they set. So however we get it, once you have it, you need to learn strategies and coping skills to deal with it.
One other thing I'd like to mention, and maybe you can say something else about this, because you've mentioned medication, and you mentioned the fact that we need to get to physicians or licensed professional counselors. You might want to talk about the fact that we as licensed professional counselors are not able to present any medication for children and what that might mean for the families.
Right. What that means, very simply, is you need to coordinate with the physician, and that's what we're going to do. Licensed professional counselors coordinate with the physician and deal with the psychological and counseling aspects of this disorder.
Thanks so much, George, for joining us tonight. We really appreciate it. We wanted to remind all of you that we're going to be back again next week at the same time. And please pay attention to your screen, because there's going to be a list of agencies and facilities and licensed professional counselors where you can get help for this disorder. Thanks, and have a great evening.